Hello student, I am Professor Devashish Bose, Head, Department of Criminology and Forensic Science, Dr. Hari Singh Gaur Vishwavidyalaya, Sagar, Madhya Pradesh. Today I am going to present a lecture of BSc 5th semester on Forensic Toxicology. The unit is Introduction to Alcoholic Beverages, which has been jointly prepared by myself and Ms. Neha Sharma, PhD scholar, a UGC JRF at Department of Criminology and Forensic Science, Dr. Hari Singh Gaur Vishwavidyalaya, Sagar. Then let's start our discussion while taking a look at what we are going to learn today. Today we have divided this lecture into 7 modules. Module 1 deals with Introduction to Alcohol. Module 2 Introduction and concentration of alcohol in different alcoholic beverages. Module 3 Consumption, absorption and elimination of alcohol from the body. Module 4 will deal about metabolism and mechanism of action. Module 5 will deal about alcohol addiction and withdrawal symptom. Module 6 treatment of withdrawal syndrome, and finally Module 7 the conclusion. Let's start with Module 1, that is Introduction to Alcohol. Dear students, first we should know about what is alcohol. So let's start the introduction of alcohol in some simple way. Alcohol are those compounds which have one or more hydroxy, that is OH functional group. The general formula we can say is that ROH, where R may be aliphatic or aromatic ring. Types of alcohol. Alcohol may be classified into 2 classes, that is aliphatic or aromatic. Aliphatic alcohol. The aliphatic alcohol are homologous series of organic compounds containing one or more hydroxylic group attached to an alkyl radical. The aliphatic alcohols can be regarded as derivatives of alkenes in which one or more hydrogen atom have been replaced by hydroxyl group. The general formula of saturated aliphatic alcohol is CnH2n plus OH, where N could be 1, 2 or 3. The saturated carbon chain is often designated by the symbol R, so that ROH can represent any alcohol in the homologous series. On the basis of hydroxy group, alcohols may be classified as monohydroxy, example methyl alcohol, ethyl alcohol, etc. Dihydroxy, example ethylene glycol. Trihydroxy, example glycerol. Polyhydroxy, example mannitol. Aromatic alcohol. The aromatic alcohol are homologous series of organic compounds containing one or more hydroxyl group attached to an aryl radical. Example phenol. But from forensic point of view, we will concentrate here on ethyl alcohol only. Ethyl alcohol, the chemical formula is C2H5OH, is a transparent, colorless, volatile liquid having a spirituous odor and burning taste. What are the properties of alcohol? The chemical name is ethanol. Chemical formula we could write CH3, CH2OH or just simple C2H5OH. Molecular weight is around 46 grams per mole. Color is clear, colorless, that is. Odor mild, rather it could be defined as a pleasant odor like wine or alcoholic. Taste, burning taste. Boiling point somewhere around 78 degrees centigrade. Melting point minus 114 degrees centigrade. Water solubility almost 1 lakh milligrams per liter at 25 degrees centigrade. So after introducing alcohol, now we shift to module 2, that is introduction and concentration of alcohol in different alcoholic beverages. Alcoholic beverages are mixture of ethyl alcohol, water and some amount of congeners. Ethanol is produced by the fermentation of sugar by yeast. Preparation of alcohol at industrial level. By the fermentation of starch. What is starch? Starch is carbohydrate and is an important source of ethanol. Generally, potato, rice, maize or barley are used as source of starch. Use of potato for starch is very common. So what are the preparation steps? Extraction of starch. The crushed potato or other source of starch is steamed at 140 degrees centigrade to 150 degrees centigrade under pressure to prepare starch solution known as mash. Germination. Before hydrolysis, starch first undergo germination at 10 degrees centigrade to 13 degrees centigrade for few days. This germinated starch is called malt. Hydrolysis of starch. Starch is hydrolyzed by maltose by an enzyme known as diastase as under given example. Starch maltose fermentation. Finally, yeast is added to maltose. Yeast secretes two enzymes. First is maltase. It converts maltose into glucose. Second is zymase. It converts glucose into ethanol as per under given reaction. By the fermentation of molasses. What is molasses? On industrial scale, ethanol can be prepared by the fermentation of molasses. Molasses is the mother liquor left after the crystallization of sugarcane juice. It is a dark colored viscous liquid. Molasses contains about 60% fermentable sugar. Step of preparation: dilution of molasses. Molasses is first diluted with water in 1:5 ratio, that is molasses water ratio by volume. Addition of ammonium sulfate. If nitrogen content of molasses is small, it is now fortified with ammonium sulfate to provide adequate supply of nitrogen to the yeast. Addition of sulfuric acid. Fortified solution of molasses is then acidified with small quantity of sulfuric acid. Addition of acid favors the growth of yeast but unfavors the growth of useless and harmful bacteria. Fermentation. The resulting solution is received in a large tank and yeast is added to it at 30 degrees centigrade and kept for about 2 to 3 days. During this period, enzyme sucrase and zymase, which are present in yeast, convert sugar into ethyl alcohol as per under given reaction. Fractional distillation. Alcohol obtained by the fermentation is known as or called wash, which is about 15% to 18% pure. By using fractional distillation technique, it is converted into 92% pure alcohol, which is also known as rectified spirit or commercial alcohol. The approximate percentage of alcohol by volume in some of the common beverages is as follows. It is taken from the book The Essentials of Forensic Medicine and Toxicology. Neutral spirit 90 to 95%, vodka 60 to 65%, rum 50 to 60%, whiskey, gin, brandy 40 to 45%, port, sherry 20%, wine, champagne up to 20%, beer somewhere between 4 to 8%. Now we come to module 3, that is absorption, distribution and elimination of alcohol. Absorption. As we know, alcohol has a very simple structure. Due to its simple structure and small size, it passes through the membrane very easily. A very small amount is absorbed in mouth and buccal cavity also. After ingestion, absorption starts from stomach and small intestine. 20% alcohol is absorbed from stomach and around 80% of it from intestine. Alcohol can be detected in blood within few minutes of taking a few sips of alcohol. About 60% of diluted alcohol taken on empty stomach is absorbed within half an hour and 90% within an hour. Alcohol can be detected in the blood within 2 to 3 minutes of swallowing a few sips of any alcoholic beverage. The maximum concentration in blood reaches within 45 to 90 minutes after ingestion, with majority of persons reaching maximum within 1 hour after ingestion. Carbonated drinks. Carbonated drinks generally fastens the absorption as the bubbles greatly increase the surface area carrying alcohol. Food delays absorption, and the delay is most marked in the presence of a fat and protein. A mixed meal can depress the maximum concentration of alcohol by about half. Food ingested with alcohol may prevent 10 to 20% of ingested alcohol from being absorbed. Warm alcoholic drinks which dilate gastric mucous capillaries are more quickly absorbed than ice or cold drink of the same strength. Persons with chronic gastritis have slower absorption rate. Absorption is most rapid at concentration of around 10 to 20%. Lower and higher concentration are absorbed more slowly. Dilute drinks such as beer may take double time to absorb as compared to strong drinks. Drinks containing more than 40% alcohol are absorbed slowly due to pyroric spasm, irritation of gastric mucosa, secretion of mucus, reduced gastric mobility. Habituated heavy drinker absorbed alcohol more rapidly than abstainer due to more rapid empty time of stomach. Drugs like benzene or atropine may slow the rate of absorption of alcohol by retarding the time of empty stomach. Alcohol is absorbed rapidly in case of gastrotomy. If the concentration of alcohol in the air is too high, the irritating properties of alcohol make breathing difficult or impossible. About 60% of inhaled alcohol can be absorbed into the systemic circulation. Alcohol is normally poorly absorbed through intact skin. Its distribution. After absorption, alcohol is distributed in different body parts. Some alcohol is lost by diffusion into the alveolar air as the arterial blood passes through the lungs. In arterial blood, the concentration of alcohol further decreases due to passage through the capillary network. Alcohol is also lost from the blood to the tissues in proportion to water content of the tissue with which it comes in contact, till equilibrium is reached between blood and tissue, except adipose tissue, as ethanol is insoluble in fat. Red cell contains less alcohol than plasma, so that a whole blood concentration is slightly less than that is in separated plasma or serum. A given intake of alcohol will produce a higher blood alcohol level in obese person as compared to lean person of the same weight, as aqueous compartment is smaller. Ethanol is distributed evenly throughout the body water, passing the blood-brain barrier easily. It is poorly soluble in body fat, as such females of the same body weight will have higher blood alcohol concentration for the same amount of drink, as their aqueous compartment is smaller. Venous blood alcohol is the absorption phase is about 10% lower than the arterial blood. This accounts for a higher concentration of alveolar breath compared to venous blood. 1 hour or more after drinking, venous blood contains the same concentration of alcohol. Capillary blood alcohol and the ratio between the concentration of alcohol in arterial blood and brain becomes constant in 1 to 2 minutes. Equilibrium in muscle required 1 to 2 hours. So, we can understand the relative concentration of alcohol at equilibrium by following table as given in the Essential of Forensic Medicine and Toxicology. Sample, relative concentration, whole blood, plasma or serum, 12 to 1.2, brain 0.85, spinal fluid 1.1 to 1.27, vitreous 1.2, urine 1.3, liver 0.85, alveolar air 0.0021. Now dear student, we come to the excretion. Alcohol is excreted through all routes of excretion. About 5% is excreted through breath. The same amount is again excreted through urine. A small amount could be excreted through sweat, tears, milk, saliva and fecal matter. Odor of alcohol is due to excretion through skin glands. Now we come to the next module, that is module 4, Metabolism and Mechanism of Action. After absorption and distribution, next step is metabolism. About 90% of alcohol is metabolized by the enzyme present in liver and rest is excreted as it is. Alcohol is first oxidized to acetaldehyde, which is converted by acetyl coenzyme A, and finally oxidized to carbon dioxide and water. Ethanol alcohol dehydrogenase, acetaldehyde, acetyl coenzyme A, water and carbon dioxide. At lower concentration, alcohol is metabolized by first order kinetics, but at higher concentration, it is metabolized by zero order kinetics. That is, at constant rate, which is independent of blood alcohol concentration, but it depends on body weight and liver weight. People who drink regularly metabolize alcohol rapidly due to induction of liver enzyme. The amount of enzyme can be increased through the regular use of alcoholic beverages, and the rate of alcohol decreases maybe almost to double. Large dose of fructose increases the rate of metabolism. During its oxidation, alcohol is not stored in tissue. It disappears from the blood at a fairly uniform rate of about 10 to 15 ml per hour. This is equivalent to about 15 mg per 100 ml from the blood per hour. Larger doses are lost rather faster. Chronic alcoholics are able to metabolize alcohol at a faster rate, that is 40 to 50 mg per 100 ml per hour, than the non-alcoholics due to an increase in liver enzyme until they develop severe liver damage. Many chronic alcoholics develop liver damage and their rate of alcohol metabolism is depressed, due to which they remain intoxicated for hours after a few drinks only. Mechanism of action. In the brain, alcohol targets protein molecule including GABA A receptor. Normally, these receptors are the destination for GABA, a neurotransmitter. Typically, GABA binds to these receptors and open a channel, letting chloride ions move inside of neurons. Once chloride ion enters a neuron, they act to slow down neurons' activity and cause relaxation, sedation, and sleepiness. Alcohol enhances this effect also. That's why people, when drink alcohol, they feel more relaxed and sleepy than usual. This is one of the action shown by the alcohol, but alcohol also shows multiple action. Apart from GABA receptor, it binds with other receptors too. We come to module 5, that is alcohol addiction and withdrawal symptoms. Although all those who drink alcohol are not addicted to it, repeated ingestion of alcohol can lead to addiction. In addicts, the normal feeling of well-being depends on a continuous availability of the alcohol molecule in the body fluid and tissue, and they have only a desire to drink, which is the only interest in life. Sudden withdrawal of alcohol for a reason may lead to withdrawal syndrome. Thus, they are normally tremulous syndrome. In this syndrome, tremulousness, anxiety, irritability, nausea and vomiting occur. Seizure syndrome. In this syndrome, hyperexcitability, insomnia, disordered perception and convulsion occur. Delirium. In this syndrome, tremors, hallucination, disorientation and ANS overactivity occurs. It occurs in chronic alcoholic due to temporary excess, sudden withdrawal of alcohol, shock after receiving an injury such as fracture of bone, etc., from acute infection such as pneumonia, influenza, etc. Next is Marichifawa syndrome. This is degeneration of the corpus callosum, may occur in alcoholics. Mallory-West syndrome, ruptured esophagus with mediasynthesis occur. Korsakoff psychosis, symptoms are weakness, pain in the extremities, wrist and foot drop, unsteady gait, loss of deep flexes and tenderness of muscle of arms and leg. Alcohol paranoia. In this, there are fixed delusion but no hallucination. The person became deeply suspicious on the motives and action of those he meets or from his own family member. Malnutrition, gastric and peptic ulcer, cirrhosis, myocarditis, pancreatitis. Now we come to module 6, that is treatment of alcohol dependence. If an addict of alcohol is willing to leave alcohol, they prefer to undergo treatment in proper supervision by experts. This treatment can be divided into two parts, that is detoxification and rehabilitation. Now we see detoxification. It can be achieved by using following drug. First is disulfiram. This drug interferes with the oxidation of acetaldehyde formed during the metabolism of alcohol. This raises the blood level of acetaldehyde, which acts directly on the cardiovascular system. Apart from the disulfiram, also inhibits dopamine beta oxidase and thus interferes with the synthesis of noradrenaline. This causes depletion of catecholamine. The drug is slowly and incompletely absorbed from the gut and is metabolized slowly. Naltrexone. Naltrexone and other opioid antagonists block alcohol-induced release of dopamine in the nucleus ambient. Naltrexone 50 to 100 mg daily reduces alcohol consumption and craving for alcohol. It has to be given for as long as 12 weeks or more. It is generally combined with psychosocial treatment also. Tiapride. This is a D2 receptor antagonist drug with neuroleptic and anxiolytic properties. Given orally, it reduces the symptoms of alcohol withdrawal. Thus, the patient remains abstinent as long as drug is continued. Acamprostate. This drug given orally reduces alcohol consumption. It is believed to act as an antagonist at GABA receptor and inhibits the activity of N-methyl D-aspartate receptor. It reduces excitement and craving that occurred in alcohol withdrawal. Lithium. It orally acts as mood stabilizer, reduces alcohol consumption and block alcohol intoxication. Second is rehabilitation. Rehabilitation is carried out in rehabilitation centers where experts prefer two therapies, psychotherapy and institutional therapy. Psychotherapy. An addict is a sick person, sometimes with a feeling of guilt. One way to overcome this guilt is to convince the addict that he is a sick person. Psychotherapy by a sympathetic doctor can often give rewarding results. Complete cooperation by the patient is very necessary also, and the person should explain that indulgence in even small quantity of alcohol would lead to relapse. Psychotherapy is supported by drugs which are used to establish a condition reflex so that the addict becomes averse to alcohol. Now we come to institutional therapy. Psychotherapy and drug therapy can be supported by institutional therapy, where the patient can see for himself the ex-alcoholics who have become abstainers and are leading a very happy life. Now, finally we come to module 7, that is conclusion. Dear student, alcoholic beverages are very common in teenagers and adults. Regular consumption makes them addict. From very early age, they start to consume alcohol during parties and pub culture. As a result of when they didn't get alcohol, they involved in different crimes and many withdrawal symptoms occur in them. For leaving this habit, they need different drug therapies and psychotherapies. Sometimes, unknowingly, people drink too much. The blood alcohol level will rise very quickly. So, if anyone accidentally drinks high concentration or high amount of alcohol, he may black out from excessive drinking. Drinking of 15 to 20 heavy drinks could be deadly. Being a student of forensic science, we should create awareness in the society about the direct and indirect bad impacts of alcohol and should help them to leave alcohol so that addicts also can lead a normal and peaceful social life. With all this information, here we come to the end of today's interesting lecture. Do keep in mind what we have discussed today. Now it's time for you all to do some self-study. This is Professor Devashish Bose signing off. If you want to learn more and enhance your knowledge, you may log on to our website for MCQs, quizzes and LOR at www.cec.nic.in. Till then, goodbye and thank you.